So breast implant illness is basically a constellation of signs and symptoms that the patients experience that ultimately affect every part of the body, literally every aspect, every tissue, because what you have is a autoimmune generated response secondary to the foreign body, which is the implants themselves, and thereby affecting, depending on the person's physiology, what they're basically have the potential to, as far as connective tissue disorders that they may be predisposed to. So patients come in with a whole series of complaints, many of which are from headaches to shortness of breath, loss of hair, ear ringing, what they call tinnitus, neck pain, back pain. They also complain of complaints of shoulder pain, tingling in bilateral upper extremities. They complain of vision changes, basically change of taste. And, there's a whole series of 40 to 50, 60, whatever complaints, and vague. But then if you look at them as a cluster, you will basically start to see a pattern that starts kind of attributing their illness to a common denominator that they have, which is the breast implant illness. Now, I've said there are patients that are predisposed to diseases and illnesses like we all do. And so the goal here is to be able to, and I tell the patients, kind of come up with a diary so that we can define a pattern, so that there are a set of symptoms depending on what part of the day, what type of compromise that they have. For example, not being able to get out of bed, not being able to exercise, brain fog, fatigue, signs, symptoms of arthritic pain. And as you will see, this is a questionnaire that I have that I give to all my patients, so that as they come in, I can kind of get an understanding as to what is it that they are primarily complaining of, so that I can get an understanding of the severity of the illness. So as you will see, and many of us have looked online on YouTube and also on so many other social media outlets as far as the complaints that the patients have. And many of my patients say that this is exactly the same pattern, because we cannot, or my primary care doctor cannot attribute it to that one specific illness. Now, this is, another very common problem is psych-related. So many of my patients have gone to the psychiatrist. They've been put on antidepressants, anxiety, fatigue. When someone has a problem with difficulty breathing, what happens? It leads to more anxiety. When someone has a problem with insomnia, that they cannot sleep, and fatigue, that leads to basically more anxiety, stress, lack of sleep, and all of a sudden this translates to, in the day-to-day activities, the social compromise, being able to function and being able to be productive. Patients have had suicidal ideations. They have had problems with literally each one of these problems, some more, some less, some none. Now, some patients may have just 5 or 10. Some patients have 30 to 50, and they just keep checking, as you will see. The most common being shortness of breath. Number 2, psych, mood disturbances, changes where they're not excited about getting up and, say, for example, going to a wedding. Small things that you would take for granted, but they themselves find it a challenge, to be a burden for them, to be able to even, for example, calling it in sick because they just cannot get out of bed. They are just like as if they just ran a marathon. That's how tired they are. They have gone to their endocrinologists. They have had their thyroid tests. They have had, name me every system of the body, the central nervous system, the rheumatological system, the GI system, the cardiology visits, where they have had a Holter monitor, chest x-rays. They have had obstructive sleep apnea studies. They have had a whole series of and battery of tests that ultimately point to nothing. And then all what they're told is, well, ultimately the final common denominator is you need to go see a psychiatrist because ultimately this is what the root cause of the problem is, because they cannot think of anything else. Another very common problem is the irritable bowel or bladder. That's also what patients present with. That ultimately is, related ultimately to the stresses of the body. So as you can imagine, people who undergo a lot of stress, they ultimately affect their GI system. So they have to go to the bathroom more, they get diarrhea, or they get constipation, and so very common problem.